My name is Dr. Brock Kerr, work here at the City Veterinary Clinic, been here 12 years. We're a multi-species practice, do a lot of cow-calf, a lot of stocker, feed yard work. We do some small animal too. I'd say we're about 70% large animal, 30% small animal. Pretty diversified practice, do a lot of equine work too. Dr. Chad and I have a cow herd together. We've ran a cow herd together probably the last 10 years. Kind of a sideline thing that's kind of grown into a whole business of itself called Kerr Brothers Cattle. You know, 200-300 head of cows at a time, and we try to keep 200 to 300 head of replacement heifers at a time. We are mainly trying to market our replacement heifers now and get into that business, with the fact is that our cattle industry is shrinking, and we're not seeing a lot of replacement heifers kept back. So we need good quality females to put back into these cow herds for people that, you know, can reproduce and have calves for 8 to 10 years. We started using Multimin about 4 years ago. We started out first in our own cow herd and our own replacement heifer program, just to see how it worked. Experiment with it. We don't like to put a new product out there with our clients unless we've tried it ourselves or there's a lot of data behind it that we like. We had really good results with it our first year. Really are happy with the way things worked. So we decided to start using it in our clients, and we have been now for 3 years, and I would say 90 to 95% of our clients use Multimin. The calves that we get in for our repro program, we usually buy those cattle around 650 pounds. We get them in, they'll get a dose of Multimin initially when we buy them. They go through and get their vaccinations and their deworming, and then we'll come back and we'll actually give them another dose of Multimin because they're all in a feed yard confinement type facility, and we'll give them another dose of Multimin in about 30 days because we just really think it helps to boost their immune system, but we also really think that it helps to boost, you know, reproductive wise, to really get them to where, you know, we're going to have a lot better chance of getting them bred and keeping them bred. Basically, we'll give Multimin twice a year. We give Multimin in the fall and we give Multimin in the spring. We give Multimin when we bring them in the fall at preg checking time or late summer, and then we use Multimin again in the spring before we turn them out to grass. Because it seems for our breeding program, it really seems to flush them out well, and our conception rates are phenomenal, even in our first and second calf heifers. In our cow herd, with our synchronization program, we're using Multimin in there right along with our synchronization program, because when we started using it 4 years ago, we noticed after that first year that we went from a 65 to 70% breeding on our first cycle to about I would say 80 to 90% depending on the type of cattle on our first breeding. Those numbers are really significant when you're trying to market a tight bred group of first calf heifers. So it made a big difference for us, and that's what really kind of opened our eyes to the product, that it must be working, because we didn't change anything else in our program. True is, when we started using Multimin in our cow herd, we saw a significant decrease in our sickness in calves. Our summer type pneumonias that guys have to fight with when you turn them out on grass, those calves that get sick and get a summer pneumonia, and then treating them on grass is very difficult. We eliminated those almost 100%. Scours, respiratory disease in young calves, you know, that are 2, 3, 4 weeks old, we've eliminated that probably close to 100%. That's what we really drug it into our clients for too, and said, hey guys, look at this. This is what we're seeing. Try this year and see, you know, start out with the 1 cc on the calves, then do it at branding. Let's see how it works for you. And it just sold itself, you know. I mean, we're not in the business to sell drugs. We're in the business to do a service and to make things better for our clients so they can make more money. And Multimin is something that we have that's a service available to us and a tool that we can use with our clients so they're able to make more money, you know, have less labor input, less sickness, less death and problems like that. Last year we had the worst drought on record. I think they said in 120 years in this area. You know, 2 to 3 inches of rain in a 12-month period. This pasture we're standing there now, it looks green. Last year never greened up, brown, burnt. A lot of guys in this area and surrounding areas really suffered through that and can understand that. And it really made an impact on our cow herds and our heifer programs. Our pregnancy rates were way down, breed bracts were way down. You know, cattle they were trying to survive and get by with what nutrients we could put in front of them. We continued our Multimin program because we just kept everything on base like it was, and we were really surprised come preg check time in late summer, early fall for our clients that the clients that were using Multimin, we saw about a 5% open rate, which was the normal, maybe a few percent higher than normal. Clients that didn't use Multimin, or people that now were clients that weren't clients before and weren't on the program, they were anywhere from 10 to 15 to 20% opens on their cows and heifers. Our worst problem was second calf heifers. Second calf heifers are the hardest animals to breed back because they're still trying to grow. They just weaned a calf. There's a lot of things going on in their body, and we didn't have the nutrients for them. We had 120 second calf heifers ourselves that we calved out and kept back, and out of those second calf heifers, we had a 92% breeding rate, which was phenomenal considering the best that we saw out of preg check time on second calf heifers was 63%. Using Multimin doesn't mean that you eliminate your mineral program by any means, because you still need all your minerals and everything. But what it does is it's a micro mineral product, so it enhances the use and the uptake of all your other minerals. The thing with Multimin is, you know, it is an injectable micro mineral, where a lot of nutritionists today are really pushing an oral micro mineral product that's the same, you know, that goes through the feed that's just like Multimin. You know, in our stance, we kind of like both. You know, we think you need to be doing both. You know, that it's a combination. Give the shot up front, and if the nutritionist wants that in the feed, that's just an extra level that you're going to get. You know, it's not, the Multimin can't get tied up in the rumen because it's going through the circulatory system. It's systemic in the body. So really, it's a product like that we see that's got a lot of benefits there, and a combination product where it's really not competing with the oral form, but actually enhancing the oral form. You know, I'd say the first thing, the benefit of using Multimin in a feedlot program or a stocker feeder type program is enhanced immune system. We know that the micro minerals in that product enhance immune system, you know, and what they can do for the immune system. I mean, you can read the data and the studies and all the work that's out there on that product, and it just tells you what it does. People do it themselves. Those products on the market like Airborne and stuff that help, that's the same kind of micro minerals in there that we see in Multimin. What we're doing is we're trying to increase the immune system of this calf, because we've never saved an animal with antibiotics. We've just helped them along so their own immune system can take care of it and save them themselves. So Multimin is one of those products that allows us to make that immune system stronger, so we don't have to use as many antibiotics, we don't have to use as many treatments, you know, we don't get as many chronic animals or as many dead animals. Farming communities, ranch communities are kind of tight-knit communities, and these guys all start talking at the coffee shop or, you know, at the 4-H events and say, you know, Doc's got me on that blue stuff, that Multimin. You know, it's a Multimin 90. I know it's in a bottle, it's blue, but they can't remember the name all the time, but they know it's blue, so it sticks out in their mind. And then guys come in and say, hey, I want to talk about that blue stuff, or I want to get that Multimin 90. I want to see what's going on with this because my neighbor says he's using it and he's really liking it. You know, and then we'll go over a program with them, and then we'll go over their whole herd program and make sure that everything else is in line too. And basically it's just a supplemental tool that really helps you in, you know, your production program. For us, the cost factor of Multimin is really not even an issue with a lot of our producers, because the fact is they see the cost benefit of it. They know what the return is going to be. We don't have to have an ad that says you're going to return, you know, 40 to 1 on your product or something like that, because they see the decreased pulls, they see the decreased sickness, the decreased summer pneumonias. They see the cows that breed back better. Maybe before where their pregnancy rate was sitting at 93%, now it's at 96%. That extra 3% makes a lot up in their mind that it doesn't take much in a $1,000 to $1,200 calf market, you know, to pay for a product really easily.